In this video by deck plate, we will understand the VA rating for laryngitis, laryngectomy, aphonia, larynx, and pharynx. Disclaimer. This video is for educational purpose only. It's not intended for doctor-patient or lawyer-client relationship. Laryngitis, laryngectomy, aphonia, and conditions of the larynx and pharynx can be linked to military service due to exposure to environmental hazards, strain from vocal demands, or trauma. These conditions impact speech and breathing, significantly affecting a veteran's quality of life. Recognizing their service connection is essential for appropriate VA disability compensation and support. In this video, we will cover the laryngitis, laryngectomy, aphonia, larynx and pharynx conditions, their corresponding diagnostic codes, and the criteria for their rating. Laryngitis, tuberculous, active or inactive, diagnostic code 6515. A tuberculosis infection affecting the larynx causing symptoms like hoarseness, cough, and throat pain. Rate under 4.88 Celsius or 4.89, whichever is appropriate, to determine disability benefits based on the disease's active or inactive status and its impact on respiratory function. Laryngitis, chronic, diagnostic code 6516. Chronic laryngitis is persistent inflammation of the larynx causing prolonged hoarseness. Hoarseness, with thickening or nodules of cords, polyps, submucous infiltration, or pre-malignant changes on biopsy. 30% rating. Hoarseness, with inflammation of cords or mucous membrane. 10% rating. This condition can significantly affect voice quality and breathing. Laryngectomy, total, diagnostic code 6518. A surgical procedure to remove the larynx, usually due to cancer. Post-surgery, patients may have altered speech and breathing functions. For total laryngectomy, VA assigned a 100% disability rating. For partial laryngectomy, evaluate the remaining impairments under the diagnostic codes for laryngitis, DC 6516, aphonia, DC 6519, or laryngeal stenosis, DC 6520. Aphonia, complete organic, diagnostic code 6519. Refers to a complete loss of voice due to physical or organic damage to the vocal cords or larynx. It results in an inability to produce sound or speech, often requiring medical intervention or therapy for treatment. Ratings vary based on the severity. Constant inability to communicate by speech receives a 100% rating, while constant inability to speak louder than a whisper rate at 60%. Note: partial loss of voice should be assessed as chronic laryngitis under diagnostic code 6516. Larynx, stenosis of, including residuals of laryngeal trauma, unilateral or bilateral. Diagnostic code 6520. Refers to narrowing of the laryngeal airway, often due to injury or surgical complications, resulting in breathing difficulties and impaired vocal function. Ratings are based on forced expiratory volume in 1 second. FEV1 percentages. FEV1 less than 40% with flow volume loop showing upper airway obstruction or permanent tracheostomy receives 100%. FEV1 of 40 to 55% predicts a 60% rating, 56 to 70% predicts 30%, and 71 to 80% predicts 10%. Note: aphonia DC 6519 may be considered if speech loss is complete. These ratings ensure veterans receive compensation proportional to the severity of their condition. Pharynx, injuries to, diagnostic code 6521. Refers to damage resulting from trauma, burns, or diseases affecting the throat. Conditions like stricture or obstruction, absence of the soft palate, or paralysis can lead to swallowing difficulties and speech impairment, qualifying for a 50% VA disability rating. Thank you for watching this video. Please don't forget to subscribe and like our videos.